Thank you everybody for joining us today. I appreciate you getting on the call. Would like to welcome Kimberly from UnitedHealth Group. She is going to be talking with us about navigating healthcare offerings and costs and learning about some exclusive discounts that PRLA members can take advantage of for medical plans and benefits. As always, we ask that you keep your lines muted during the presentation, and you can use the chat feature to ask some questions at the end. And with that, I am going to turn this over to Kimberly.
Great, thank you. Thank you, Hope. Welcome, everyone. Thank you for joining us this morning. So just for some background, so UnitedHealth Group is a party to a joint venture partnership between the National Restaurant Association. And so under that joint venture partnership, or within it, we are also partnered with PRLA, and we've been partnered for, gosh, a long time, probably 6, 7, 8 years now. You were one of the first to jump into this partnership. So we appreciate our friends in Pennsylvania. What we do as a part of this joint venture is we support health and wellness in the hospitality industry. We support population health, and my job is to identify solutions that will meet needs of restaurateurs, hoteliers, and employees in hospitality, which are unique needs. And so that's why we do what we do. The joint venture that we're a party to is actually a separate legal entity, and it's owned half by UnitedHealth Group and half by the National Restaurant Association. So it's a very unique partnership and allows us, it's sort of a platform for developing members-only differentiated solutions that, as I said, can help meet the needs of the hospitality industry. And so in this platform, we have a whole variety of solutions that can help people get healthy, be healthy, stay healthy. Gosh, especially during this horrendously difficult and tragic time for hospitality. So we're going to go through all these different solutions, and so you can see if any work for you and your employees. So as we all know, the vast majority of folks in the hospitality industry don't have access to medical benefits or any other type of health benefits, and so no resources from a health and wellness perspective, because they're either part-time or now furloughed, part-time, kind of cobbling together jobs to put food on the table. Or just can't, maybe they're full-time and maybe their employers do offer health benefits, but they can't afford to participate, or for some reason there are no resources for them. So that's one of the things that I've been focusing on, just trying to pull together resources that everyone can access, regardless of, part-time, full-time status, anything like that. So the first thing I'll talk about is the benefits, the medical benefits, and UnitedHealthcare is one of our partners, and there are multiple types of solutions and discounts, and special pricing, and things like that for PRLA members. If you wish to purchase medical benefits, depending on the type, whether it's self-funded, whether it's fully insured, things like that, there are specific benefits, discounts, depending on the group size, depending on the products purchased and things like that. So happy to talk more about that. If anyone is interested, feel free to ask questions. Feel free to ask questions anytime during the presentation, or make this more of a dialogue than a monologue. One of the things I want to point out is this is something that is this offering, which is 5% off policies like dental and disability, vision, life insurance, critical illness, things like that. If employers don't have the margin to offer medical benefits, this is really such a great option to offer something instead of nothing. And benefits like this, dental, vision, disability, et cetera, so reasonably priced, especially with the 5% discount. I really encourage you to ask questions about this. Call Amy Hathaway. This is really an amazingly priced option, and we have a lot of hospitality groups that will only purchase dental or vision or critical illness coverage. And as I said, it's incredibly affordable. And you can even do it as a voluntary benefit where the employer actually doesn't have to contribute at all. It could be entirely an employee paid benefit. So I always like to encourage people to look at that. We all know that medical benefits are incredibly expensive. These are other great ways to show your employees that you care, help with loyalty, turnover, create that stickiness by doing something. Now, the rest of the solutions I'm going to talk about have nothing to do with insurance, have nothing to do with United Healthcare. These are all solutions that we put together, we developed with various product partners to be available to everyone, absolutely everyone in hospitality. So again, you don't need to have insurance. There aren't participation requirements. Every single employee is eligible for these next solutions. So this one, Teladoc, is, I'm so grateful to Teladoc. They're such a great organization. They are the global leader in virtual medicine, telehealth, and I'm sure that everyone has heard about the virtues of telehealth, especially during COVID. This is the future of medicine. It's going to be virtual to the extent that it can be. And Teladoc, as I said, is the global leader, which is why we selected them to partner with. And this is an amazing offering. That's just I can only describe it as a gift to the hospitality industry. And so let me describe it for you. This is amazing. So it's, again, available to everyone, uninsured, full-time, part-time, even your furloughed employees, just to help them get healthy, stay healthy, be ready to come back to work when the time comes. And so what this offering is, it costs $7 per month for an employee and that employee's entire family. And that $7 allows that employee and family to have unlimited access to virtual visits. And this is for medical conditions and mental health conditions. So you can sign up any or all of your employees. Very easy to sign up. You can do it. You can add people month to month, remove people month to month. Very, very easy to sign up. The Teladoc folks are very happy to work with anyone and help get you up and running. This is really, I can't say enough about the gift that this is. This $7 a month price tag is something that no one else has access to, just members of our association partner organizations. So again, amazing opportunity, amazing way for people to have access to some kind of health resources, whereas they don't have that right now. Now, these Teladoc employs only doctors. There aren't any physician assistants or nurses that handle the calls. They're all physicians, and they're all practicing physicians that do this, as well as being involved actively in their own practices or hospitals. So great, great solution. These physicians can prescribe medications virtually, and if you've never had a virtual visit, highly recommend it. It keeps people away from crowds, keeps people out of urgent care and emergency rooms. The opportunity for employers, even employers that offer insurance to their employees, can save on medical costs, can reduce medical costs significantly. We have so much data that shows that virtual visits and using Teladoc will reduce an employer's medical costs over time. It not only does it make it easy to get care 24 hours a day, 7 days a week. It encourages people. Essentially, employees have no excuse not to seek care, and early care saves costs, saves claims costs, reduces renewal rates, etc. Keeps people, as I said, emergency rooms, urgent care, biggest cost drivers, medical cost drivers, and most of the time, the vast majority of the time, people don't need to go to the ER or the urgent care, and so virtual visits saves those unnecessary trips to urgent care and emergency room, and there are no claims involved. So the opportunity to control medical costs is huge using virtual visits. So have any questions about this, or how you can save money using this option? Reach out to me, reach out to Amy. You'll have our contact information at the end of the presentation.
Kimberly, there's a question in the chat about, I don't know if can you see the chat?
I cannot.
Okay, it says if a doctor prescribes something during a visit via Teladoc, is there any insurance coverage or / reduced rate for prescriptions?
Only if someone has insurance. So it would be, so say somebody, I don't have health insurance, I have a Teladoc visit, medication is called into my pharmacy, I would pay for that medication out of pocket because I don't have insurance. Now we do have, I'll be talking in a few minutes about we do have a pharmacy discount program that is great to use along with the Teladoc solution if people don't have insurance, or people have a really high deductible and have to pay out of pocket anyway for prescriptions. So the Teladoc, in conjunction with the pharmacy discount program, really work very nicely together. Did that answer your question?
I was reading someone's question. Yep, she said yes, it did.
Okay. Yeah. And you said, hope there's another question?
Nope, I didn't see another one.
Okay. Now. All right, great. By the way, I do apologize that for some reason my PowerPoint will not go into a presentation mode, so I apologize that you see all the stuff on my screen. All sorts of technical difficulties. Okay, so the next solution, we partnered with this organization called Let's Get Checked. We partnered with them on COVID testing because they're the only FDA authorized organization that owns all of the aspects of the testing process. None of the others do, so they're all very disjointed. But this, they own the generation of the test kits, development of test kits, the distribution of the test kits, and then the testing of the samples, and the physician, the medical expert, patient support. So that is why we chose to partner with Let's Get Checked. Let's Get Checked, you can find them, their brand in Walmart and Walgreens and CVS across the country. They made this COVID-19 test available to us at an exclusive price at $107 per test, and this includes the shipping, expedited shipping, the results, the analysis of the sample and the results, all under that price. And so only members of our association partner organizations can get this price. This is the price for organizations and employers to order tests for their employees. And the minimum test, and I should have included this, I apologize, but it's 20 tests for that 107 price. The accuracy of these tests is 99.8%, and actually they have actually had no inaccurate results. That the 99.8 represents simply the statistical requirement for, declaring accuracy. So we've seen, obviously, COVID has affected the hospitality industry in such a dramatic and tragic manner. Testing is one of the things that really, the very, very large and loud cry for help on testing. And so when hospitality employers are trying to reopen and stay open, and just one infected employee can affect that plan so dramatically. So we're finding a huge need and demand for these tests. So again, that's the full COVID-19 test that can accurately determine if someone has COVID-19 or does not. We also have just partnered with an organization that will make rapid tests available. Now, the full tests take between 24 and 48 hours to get the results, which is actually an incredible time frame, considering that most people wait a good couple weeks to get their results from other sources. But the rapid tests give results within 15 minutes. These tests will be, for us, under $20. I believe they will be $18 for the test. These are for antibody and antigens. So this was also a huge demand and request from my friends in the hospitality industry. These are, people want to test their employees. Antibody and antigen tests don't take the place of the full COVID-19 test. They are more indicators that someone needs further testing or someone doesn't need further testing. Nonetheless, there's a huge demand for these antibody and antigen tests, so we are going to make them available as soon as the FDA approves them for at-home use, which we're expecting in the next 4 to 6 weeks. So look for more information on these tests as well. Any questions on these tests? Okay.
I didn't see anything.
Okay. So the other component of this, our partnership with Let's Get Checked, is outside of COVID, and this essentially gives your employees and anyone access to essentially anything you would go to a lab for. So everything from thyroid to colon to Lyme disease, diabetes, cholesterol, all sorts of different tests, which, again, the idea is to keep people out of crowds, people want personalized, convenient access to health and wellness tools. And that means at home, at their own time, in the middle of the night, if they want to be tested at 3 o'clock in the morning, they can do so. They don't have to go into a doctor's office to get an order for a lab test. They don't then have to go to the lab to have the test and then wait. Simply order it online. There's a 25% discount for members using the code hospitality25. Results are delivered directly to the patient online with medical personnel to help and offer support. I've done this. I've tested these tests. They're as easy as can be, and again, the accuracy is very, very high. And love this solution for folks who don't want to pay to go to the doctor, don't want to pay to go to the lab. They simply pay the one price for the test and have the results very quickly. So this is something you can pass along to your employees. This is the prescription drug program I was referring to. So this is a nice program. It's people save a lot of money using this program, up to 80% on most FDA-approved drugs. Every pharmacy, with the exception of Kaiser, I don't believe Pennsylvania has Kaiser. I believe it's just Southern California and the Mid-Atlantic. Kaiser only accepts Kaiser plans and cards and things like that. So every other pharmacy, whether it's CVS or Walmart or Sam's Club or Costco or your grocery store, accept this card. And so it's there's a nice website where people can go and nice functionality. They can go and plug in their prescription, plug in their zip code, and they can see a comparison of all the different pharmacies in their area, the different costs at the different pharmacies, which sometimes is significant. You can pay significantly more or significantly less by going up the street to a different pharmacy. Well, people can see that online, see their discount, and it's just a nice program. As I mentioned before, for people who don't have prescription coverage, or for folks who have so many folks, almost everyone has a high deductible plan now if they have medical coverage, and so all prescriptions will come out of pocket anyway until you reach your deductible. So this is just a nice way to get a discount if your insurance hasn't kicked in yet, or you don't have it, or you have a high deductible. Okay, I'm going to talk about mental health, and then I'm going to switch over to a different presentation because we just we have another offering that we just found out about. So let me move forward here. So I want to talk for a minute about mental health, substance use disorder, suicide prevention. I've been asked for the past few years by friends in the industry, by my friends at our association partners, for resources that will help with the upwardly trending mental health issues, substance use, suicide, concern in hospitality over the past few years. And so I started getting involved in this in earnest about a year ago, partnering with some great organizations to really dive into kind of the drivers of this in hospitality. During COVID, of course, the need is so much more urgent, with folks feeling so isolated and hopeless and frightened, and people need help. People desperately need help. And not only that, but I want to point out that all of us, even though we might not think of ourselves this way, we're not on the front lines, et cetera, like medical personnel, but it's a fact, it's data-driven, evidence-based medicine that every single one of us that has lived through the last 8-9 months is compromised from an immunity perspective. So we have been living on high level, everyone has been living on high levels of adrenaline, cortisol, and that changes your physiology, and it changes your psychology and your physiology, and the result of that is that we are less able to fight off physically and mentally things like a basic cold or the flu or anxiety or depression. So we've got to do something about that, especially with the next with this winter coming, and nobody really knows what COVID is going to look like this winter, but we do know we have to get flu shots. Everyone needs a flu shot. Now, October's the month, so I encourage everyone to go get a flu shot this month. You can get them for free all over the place. Because we have to protect ourselves against the basic things that we would normally be able to fight off better, more effectively, and that includes mental health. So we partnered with a whole bunch of really phenomenal organizations to help with this. Active Minds first here, and I partnered with Active Minds starting about a year ago, and we Active Minds is a nonprofit focused on mental health and suicide prevention, and so we partnered. I underwrote a study of the hospitality industry. We had focus groups. We surveyed people. We are almost finished with a guidebook that we'll make available to everyone for free. That shows very interesting, shows the data that we collected, shows the drivers. What is it that's specific to the hospitality industry that contributes to the high instances of mental health challenges, substance use challenges, and suicide. So I'm very excited for that to come out. I think we can help a lot of people. And the idea is just making sure that no one suffers alone, making sure that everyone who wants resources has resources. And so these partners have stepped up and made their resources free to the hospitality industry, which I'm so grateful. Stand Velo is an incredible app. It's the #1 rated app for stress and anxiety and depression. They have graciously stood up a hospitality specific landing page, which is right there. And it's phenomenal. It's based on cognitive behavioral therapy, and really most of my team uses it every day to sort of keep ourselves together. I always say I don't think you're alive if you're not slightly stressed out at this point, and need a little help with anxiety. So Stand Velo is an incredible app that I absolutely love. Patients Like Me also so graciously offered to stand up a hospitality page for us. Patients Like Me is a network of it's a free network, and you can go on Patients Like Me and find similar communities of people that have similar situations that you have. It could be people who are taking the same medicine for heart disease or diabetes, or who have been diagnosed with thyroid issues or depression or anxiety, things like that. People who are taking the same medications, have the same symptoms, things like that. You can just log on, share information, connect. The data shows that people improve their outcomes by learning from other similarly situated individuals. So really, really phenomenal resource. Ben's Friends, love the gentleman who started Ben's Friends about 20 years ago. It's essentially an AA or NA for hospitality, people who work in hospitality, who understand each other and the unique challenges in hospitality. They have a telephonic meeting weekly, and then they also have in-person meetings in various places across the country. And we've got a variety of helplines available for immediate help. And then again, the teledoc solution, which is the only thing I couldn't get for free, but $7 is pretty close. $7 a month is pretty close. So what I love about this teledoc solution is that mental health is included in it. And mental health is often excluded from virtual visit platforms. So, when you think about this and you think about how a person with a high deductible plan or without insurance, and think about the daunting prospect of going to get help, mental health assistance and support, and they're looking at spending out of pocket, $300 for a psychiatrist appointment, $200 for a therapist appointment. Nobody has that kind of money, and so they're not going to get help, and which is tragic. And so the fact that if an employer enrolls an employee for $7 a month in this Teladoc solution, that employee and that employee's family has unlimited access to mental health visits. That means they can have a mental health visit with a psychiatrist 5 times a week, and it's still $7 a month. There's no co-payment, there's no anything. So absolutely love this, and it can help so many people. So I also just put in a little extra information about Patients Like Me, which I think is just an amazing platform to get answers, kind of take charge and heal, and get your questions answered about a symptom, about a condition for a child, a loved one, yourself. Anyone who's ever had small children knows that small children figure out ways to have really weird things happen to them, and parents have no idea what's going on or how important or how, do I need to rush to the ER, or is this okay? And can I take my shift, or do I need to go home, kind of a thing. Just a really, really phenomenal resource. And this is Sanbello. Again, can't say enough about Sanbello. So I encourage everyone to log on to Sanbello and see what it can do for you. It's really, really a phenomenal mental health resource. Here is our contact information, but first I want to just show you one more thing. So I'm going to pull up another presentation and hopefully figure out how to share my screen again. In the meantime, you can think about if you have any questions, add them to the chat box. While I am finding this other information. Okay, here it is. Let me share my screen again.
While you're sharing your screen, we did get a question asking, do you offer any group medical benefit programs for companies with less than 51 employees?
Yes, absolutely. Absolutely, we do. We offer from 2 people to, thousands and thousands and thousands, And Amy, so Amy is going to be your expert on that, and she can help you, figure out that, what type of, she can get you hooked up with the right individuals, and she can give you all the information you need about how to apply for a quote, regardless of what size business you have and how many full-timers you employ.
So basically he should just reach out to Amy.
Yeah, exactly. Yep. Okay, for some reason I'm having trouble here. I apologize, everyone. Just give me a moment.
I just put Amy's contact information into the chat box because I know it's not up on the screen right now, just so that he had it.
Okay. So I am not sure why I can't share my screen again. You can't see my screen, Hope, can you?
No, I can't.
Do you have the share screen button? Is there an issue?
Do I have what?
Do you have the
share
screen button, the little green button? Is it not showing up for you or something?
It is not at the moment. It's not showing up for me. So here's what I'm going to do. I'm going to send you, Eric.
Okay.
And Hope, I'm going to send you what I wanted to pull up. And so hopefully you can pull that up.
All right, I'll get it, Hope.
Okay.
Sorry about that. I don't know what, I don't know why it's not allowing me to pull it up.
Technology is not always our friend.
It's not, I don't know.
Did anybody
So
have
let
any
me
other
know.
questions for Kimberly? Well, if not, we will definitely be sharing this presentation and in its entirety, and all the contact information will be at the end. And we'll make sure to share their contact information with you so that you can reach out to them on a one-on-one basis if you had questions that you didn't feel
Perfect.
comfortable sharing right now.
Yep, absolutely.
And we will share the additional, oh, is this what you were looking for?
Yes.
I was like, oh, something just came on my screen.
Okay. So you have, are you sharing your screen now with this?
I don't know, Eric. Oh, Eric is. Eric must have brought it.
Okay, perfect, perfect. I apologize. I don't know what is going on with my Zoom access, but okay. So this is this is something that we're so excited about. This is our friends at Kaya. So Kaya is a digital solution that helps people manage musculoskeletal disorders, which are, of course, very prominent in hospitality, back, et cetera, just because of the nature of the jobs. And so starting next week, everyone in hospitality is going to have free access to a virtual program to help with back pain. And this is so, I'm so impressed with our friends at Kaya for making this offer. It replaces, good, this is so essentially it's artificial intelligence that helps people virtually with physical therapy. So, replaces the high cost. Again, think of your employees that have an injured back going to physical therapy 3 times a week for 6 months. That's not going to happen. So they're not going to get better. This is free and helps them anytime, at their own time, whenever, wherever, in the middle of the night, they can do this physical therapy that's virtual. Helps keep people away from, addictive painkillers, surgery, et cetera. You can go to this YouTube link and see what it's all about. But anytime, anywhere, using their own phone, it's absolutely free. And so I would really encourage 15 minutes a day. If you want to go to the next slide, Eric, 15 minutes a day. The results, the data are astounding that show how Kaya can help folks through their back pain therapy program. All personalized to the person's body, pain level, skill level, et cetera. So it's a really, if you want to go to the next slide, and we'll send this out as well. It's a really just phenomenal resource and uses a holistic approach to pain and managing pain, education, exercise, mindfulness, all of the pain science, the components and latest research in pain science. So very, very thrilled that we'll be able to offer this again next week, thanks to the leaders of Kaya, and hope that everyone takes advantage of this. Thank you. Thank you for jumping in there, Eric, and getting that on your screen. So that's what we have. We will be working. I'm always working on bringing more new and different and additional health and wellness resources to hospitality. So as the months pass, we will be bringing more and more your way. And happy to answer any questions. Happy to chat one-on-one. Amy Hathaway on my team is our expert for everything, all things Pennsylvania. And so feel free to reach out to Amy. She's absolutely fabulous, can answer any question you have, or reach out to me anytime. We're happy to help. And we're here to help. That's why we exist. So
I
Any
don't
more
see any
questions?
Yeah, I don't see any more questions. I think you've covered this very thoroughly. I appreciate you taking time to do this for us, Kimberly. And
Absolutely.
as I said, we will send it out with the recording and all the contact information for Kimberly and Amy, but Amy will be your main contact. Or you can reach out to us internally and we can connect you with them. But thank you again, Kimberly, and thank you everybody for joining us today. We appreciate it.
Absolutely. Thanks, Hope. Thanks, Eric, and everybody. Have a great day. Stay safe.
Have a great day. Thank you. Bye-bye.
Take care.
Bye.